11 drugs that produce hyperkalemia. Hyperkalemia is a condition where there is an increased potassium levels in the blood. So normally the potassium levels within the body are within the range of 3.6 to 5.2 millimoles per liter. So when these levels are above 5.2, there is a significant increase in the potassium levels in the body. And the levels of potassium can called as abnormal levels when the concentration of the potassium within the blood is greater than 6 millimoles per liter. So when it is greater than 6 millimoles per liter, hyperkalemia is very severe and it should be immediately treated. Now in this video, let us see which type of drugs can induce the hyperkalemia. Before going to that, let us see what happens with this hyperkalemia, why it is so much important to control the potassium levels within the normal level. So with hyperkalemia, first of all, we can observe the apnea, there is a difficulty in breathing, and nausea and vomiting, fatigue, and muscle weakness. These two are very important. When the potassium levels are going to be increased, the muscle is going to be affected, leading to fatigue and muscle weakness. And palpitations. And finally, this is very important, cardiac arrhythmias. The decreased potassium levels as well as increased potassium levels can disturb the cardiac rhythm, so leading to cardiac arrhythmias. So these are the various symptoms, and cardiac arrhythmias are very fatal with raised potassium levels within the body. What are the reasons for this hyperkalemia? So drugs can cause the hyperkalemia by two mechanisms. A drug can inhibit the function of the kidney, thereby it can decrease the potassium excretion directly. Otherwise, a drug can act by another mechanism. It is going to inhibit the aldosterone secretion as well as its action, thereby it can decrease the sodium reabsorption. When the sodium is not reabsorbed, that means sodium is more excreted, and when the sodium is excreted, potassium is retained in the body. So the decreased sodium reabsorption will result in the decreased potassium excretion. In this way, drugs can affect directly on the function of the kidney, otherwise they can act on the aldosterone secretion or action, thereby they can increase the potassium levels within the body. So now let us see the various drugs one by one which can induce the hyperkalemia. So the first one is ACE inhibitors, angiotensin converting enzyme inhibitors. So angiotensin 1 is going to be converted to angiotensin 2 by this enzyme, ACE enzyme. Then the angiotensin 2 is going to increase the aldosterone secretion, which is responsible for the sodium reabsorption. Now, drugs called as prils like captopril, lisinopril, ramipril, enalapril, all these drugs are going to inhibit the ACE enzyme, thereby they inhibit the secretion of the aldosterone. And as already we have seen, when there is no aldosterone is secreted, sodium is not reabsorbed, that means sodium is excreted, which results in the retaining of the potassium, thereby potassium levels within the body are going to be increased. So ACE inhibitors like the prils can induce the hyperkalemia. Second types of drugs are the ARBs, angiotensin receptor blockers. So these are the similar drugs like ACE inhibitors, but they act on the angiotensin 2 receptors. Angiotensin 2 acts on the angiotensin 2 receptors, thereby it is again increase the aldosterone secretion. Now again, the drugs called as sartans are going to inhibit these angiotensin 2 receptors, thereby they inhibit the aldosterone secretion. So just like the ACE inhibitor, sartans can also induce the hyperkalemia. And third type of drugs are the beta blockers. So we have various drugs like propranolol, nadolol, timolol, pindolol, so many types of beta blockers, and particularly these are non-selective beta blockers. So beta blockers like the propranolol can affect the release of the renin, and particularly they acting on the beta receptors, thereby they inhibit the renin release. As the renin is not released, angiotensin 2 is not formed, thereby sodium is not reabsorbed, which results again in the retaining of the potassium, leading to hyperkalemia. In this way, beta blockers can affect the renin release, thereby they increase the potassium levels in the body. Fourth one is the succinyl choline. Succinyl choline is also called as suxamethonium. So suxamethonium is a depolarizing neuromuscular blocker. That means it initially produces the muscle contractions, and by continuous muscle contractions, muscle is unable to contract and then paralyzed. So that's why it is called as depolarizing neuromuscular blocker. So now succinylmethonium initially produces the muscle contractions, and as the muscle contractions are increased, this results in the increased potassium efflux from the muscle. So now potassium is going more out of the muscle into the blood, leading to hyperkalemia. So succinyl choline can also induce the hyperkalemia by increasing the potassium efflux from the muscle. And fifth one is the aldosterone antagonists. So drugs like spironolactone and eplerenone, these two drugs are going to inhibit the aldosterone receptors, thereby they decrease the sodium reabsorption. And as already we have seen, when the sodium reabsorption is decreased, it leads to the decreased potassium excretion, leading to hyperkalemia. Sixth one is the NSAIDs. So drugs like ibuprofen, aspirin, and so many NSAIDs are there, non-steroidal anti-inflammatory drugs. These drugs again directly affect the renal functionality. So NSAIDs can decrease the glomerular filtration rate, and when there is a decreased glomerular filtration rate, potassium excretion is also decreased, leading to hyperkalemia. Seventh type of drugs are the calcinurein inhibitors. So drugs like cyclosporine and tacrolimus, these are the two drugs which are acting like immunosuppressants, and they inhibit the calcineurin. These drugs are resulting in the renal tubular dysfunction, again thereby they decrease the potassium excretion, leading to hyperkalemia. And other types of drugs. So other types of drugs include digoxin, trimethoprim, heparin, and propofol. All these drugs are having again the chance to increase the potassium levels in the body, resulting in the hyperkalemia. So in this way, these are the 11 types of drugs which are going to increase the potassium levels in the body, either by directly affecting the renal function or by inhibiting the aldosterone secretion, which results in the excessive potassium levels in the body. Hyperkalemia is a very significant condition which should be immediately controlled, otherwise it can initially lead to the difficulty in breathing, muscle weakness, and fatigue, but at a very abnormal levels it can lead to the cardiac arrhythmias, which is fatal to the patient. So whenever these drugs are given, we have to check for the potassium levels, and these drugs should not be combined so that the hyperkalemia may be excessively increased.